Good morning, students and staff. My name is Douglas, and joining me today is Priya.
Before we begin, I would like to thank everyone for coming out today and joining us for EDS Awareness Assembly.
Today we will be learning about a disorder called EDS.
We have lots planned for you guys today, so before we begin, we will begin with a short video introducing the topic of EDS.
The 14-year-old girl in this video is speaking based on her own experiences as a patient suffering from EDS. Now we would like to welcome our first guest speaker on stage.
Her name is Sandy. She is the founder and executive director of the ILC Foundation for Youth and Chronic Pain Care Program.
Thank you very much for inviting us here today. The work that you've done in the class, Mrs. Daniels' class, is just tremendous. Raising awareness about Ehlers-Danlos syndrome is so important. And chronic pain diseases, oftentimes people will go for years not knowing what's wrong and why they're experiencing joint pain, back pain, headaches, stomach ache issues, and then only to learn years later when they finally get to a geneticist that perhaps they have a connective tissue disorder like Ehlers-Danlos syndrome. Madison gave voice at our conference last year in November in Toronto, where we had a group of medical specialists from multi-disciplines that came to speak about what they knew respectively about Ehlers-Danlos syndrome, and that gave hope, and you're expanding that today here with your school, your school community and the class, and thank you very much. I'm really touched and honored to be here to support your family, and I'm glad that you're getting this support and helping to raise awareness. So thank you. Thank you very much.
Thank you very much, Sandy, for coming to our school today and helping us raise awareness here at Lincoln Alexander about EDS. And what we are doing for the cause. On our behalf of Lincoln Alexander student body, please accept this token of our appreciation.
Next, we have a PowerPoint presentation made by our very own students, Tahir, Arveen, and Danae, who are also participating in our leadership class.
Ehlers-Danlos syndrome. Don't let chronic pain win the game.
What is Ehlers-Danlos syndrome?
Ehlers-Danlos syndrome, also known as EDS, is an inherited connective tissue disorder, which primarily affects the connective tissue that supports many critical body parts such as skin, muscles, and ligaments.
It is the result of not having enough collagen, which is a protein that basically acts as a glue for your body, which adds strength and elasticity to connective tissues.
Collagen is essential for healthy functioning of the body.
Some of the symptoms and challenges faced with having EDS:
loose and unstable joints,
fragile skin,
and easy bruising.
So here we have a poster with the EDS symbol, the zebra.
Overall, an extremely fragile body.
Lincoln's fundraising goal for EDS syndrome.
We plan on having a class buyout on May 5th, a student versus teacher obstacle course, and the cost is $2 per student.
A second fundraising event will be held on May 27th.
Dancing with the Stars will be held on May 27th with numerous guest stars in attendance, including
Jagmeet Singh,
Latoya Robinson,
Miss Brampton 2014 Tanya Franklin,
and Mr. Broda.
Other guest stars in attendance include Jason Martin, Mr. Lester, Carrie Crawford. All right, so why the zebra for the mascot? When you hear hoofbeats, think horses, not zebras. Medical school students are frequently taught this phrase in an effort to prevent them from making an incorrect diagnosis of a rare disease. A medical zebra is a rarity, and EDS is considered a rare syndrome and has adopted the zebra as a mascot. Often people who suffer from EDS find it very difficult to get a correct diagnosis, and so it must be emphasized that though they may be rare, but zebras do exist.
Thank you for listening.
Next, we would like to welcome Dr. Kim Daniel.
For those who don't know, Dr. Kim Daniel is a psychologist and is also Miss Daniel's sister, so let's give her a warm welcome.
Hi, everybody. I'm so impressed with today. I have Ehlers-Danlos syndrome, EDS type 3, so I'm very hypermobile. I was diagnosed 2 years ago only, and as a kid, I was in gymnastics, so having EDS and being very hypermobile, it was for my favor. It was until I got older and my knees kept on dislocating. I was falling a lot, and I was in severe pain. My shoulder would pop out. As you can see, my fingers pop out and dislocate. So the emergency hospital was my friend at that time. I'm here today to support you guys supporting EDS, and I'm very touched. I want to thank my sister, Nadine, because this means so much to me. As you guys heard, we have good days and bad days. I go with the weather, so today is one of those off days, but you know, I always hope for a good day. And actually being in front of you all and being here, that really touches my heart. So it's a good day. So, you know, you heard all the symptoms of EDS, and I get really tired quickly. I start walking and stuff shifts, and I dislocate in my sleep. I know if you could imagine, this is what happened here until I woke up and I realized, hey, my fingers are twisted or out of joint. So it's one of those things that you try to, you know, deal with the pain as much as possible. And I'm just so flattered to be here today and represent, be a representative here. And I also want to thank Miss Daniel's class, because you guys are amazing, and I really appreciate everything you do, so a round of applause for you guys. And I'm going to do my best with the Dancing with the Stars. I don't think I can move like that, but yeah, it should be fun. If you guys have any questions afterwards, please feel free to ask me. There's no such thing as a dumb question. And I'm still trying to find questions for myself and trying to find help, because right now there's little help, and it's trial and errors for most doctors in dealing with patients with EDS. So the more we bring out awareness, the more that we do fundraising, I want to hope and I have faith that we're going to find, you know, some sort of cure or just like some way to cope so people with EDS could function so well in today's society. So that's my speech. Thank you.
Thank you so much, Dr. Daniel, for sharing your experiences and struggles living with EDS with us. On behalf of our school, please accept the gift as a token of our appreciation.
Now we would like to welcome two of our Lincoln students up, Christian and April, to perform Lean On Me.
Sometimes in our life we all have pain. and I'll be your friend. I'll help you carry on, for it won't be long till I will need somebody to lean on. Lean on me when you're not strong, and I'll be your friend. I'll help you carry on, for it won't be long till I don't need somebody to lean on. Everybody now, woo! Lean on me when you're not strong, and I'll be your friend. I'll help you carry on, for it won't be long till I don't need somebody to lean on. Woo!
Okay. Where is she? Yes, you want to say anything? Ladies and gentlemen, this is my wonderful leadership class of 2015. Can we give them a big round of applause?